News for your health and well-being, and for parents whose children take attention deficit hyperactivity drugs and are not yet firefighters. Food and Drug Administration Advisory Committee is now recommending that the agency add a warning to ADHD drugs about a possible risk of hallucinations in kids. Joining us now in Studio B is Dr. Jamie Wells, a pediatrician here in the tri-state area. Hallucinations from what?
From Ritalin and Concerta and Adderall, different stimulant medications.
What are they hallucinating about?
Well, hallucinations can occur with a lot of medications. If you take pseudoephedrine, which is in over-the-counter medications for decongestants, you can hallucinate from them, speed the heart rate. So nothing is very new about this. It's just that they're adding the warning. But they've chosen not to add a black box warning, which would dramatically change prescription
What's the difference?
numbers.
What's a black box warning?
If the FDA would put black box warning on a drug, then pretty much no one would prescribe it unless they wanted to face the ramifications of that, I guess. It's a stronger warning, basically.
Because it's easier to get a malpractice suit or easier to get in trouble if something goes wrong?
Well, I think that it kind of protects the FDA more than necessarily the individual. But this warning is basically that they found that hallucinations occurred with kids taking drugs for ADHD.
It's not just any old hallucinations. They're dreaming about creepy crawly things and worms and snakes. I don't know what makes them do that, but that's what the warning says.
That is what
worms and snakes and crawly things. That's weird.
Well, the warning...
there are only 3 kids in America who don't take Ritalin.
That's not true.
Well, it seems like. We prescribe that drug a lot.
I think it is prescribed quite often, but if it's prescribed safely by a psychiatrist or a neurologist in a child who's diagnosed with ADHD and taken as prescribed, then it has been proven to be effective. Now, I can say that as a general pediatrician, I've never prescribed Ritalin or any of those stimulant medications. So if someone's at risk for having ADHD... Some people party on that drug, too. Well, that's the biggest problem, is that it's a substance that can be abused in kids who don't have ADHD. So it needs to be, when prescribed to a certain child in a certain family, it needs to be just one small part of the prescription, of the whole process with treating ADHD.
Adults can take it too, right?
Adults can take it, and in fact, they found problems with adults taking it.
Yeah, I could probably use it. Probably. It's good to see you.
Good to see you.
Thank you. Coming up from Studio B, you're sitting in a bar, right, having an adult beverage or two, minding your own business, and in comes Johnny Law and locks you up and hauls you away. It's just mind-boggling to me, but it's a crackdown on intoxication, and it's coming up next, so don't miss it.